So again, incredibly difficult acts to follow. I will attempt to do so. Thank you for the introduction, Dick. And I'm going to talk about health disparities from a societal practice. I wanted to take a little bit of a departure and talk about some of our work in Russia and how it relates to what we experience here in the US, and I'm sure in many other parts of the world. I will just start by saying, despite about a decade of working with incredible colleagues in the Russian Federation, primarily in Siberia, I want to acknowledge solidarity with Ukraine. I support border restoration and the immediate end to the Russian invasion. But we are here because of this incredible person, Dick Guerrant, who you've heard from already. You know, just trying to think about what will sustain us as a scientific community when confronted with what appear to be these just existential threats of violence, of societal changes that threaten democracy around the world. One has to remain optimistic, and I don't know if I know another more optimistic person. And so in his book, which I encourage everyone to read, among others that I have highlighted, he is talking here about extinction events. What could be more concerning than you know, the extinction of our populace? But this is how Dr. Guerrant describes the way that we may move beyond such events, and that is to continue the trajectory of improvement for a better, more compassionate, equitable, and caring species that succeeds evolutionarily, because the advantages of working together so vastly exceed the disadvantages. So I will try to weave a story that will hopefully move us in that direction. So it begins in 2012. This is my first visit to Russia, but also to Irkutsk, as I mentioned, an oblast in the eastern part of the Siberian region, and was pleased to join a delegation led by the man in the upper right, a doctor by the name of Harvey Sloan, former mayor of Kentucky, lost a couple important races, including a Senate race to one Mitch McConnell, if those of you that follow US politics. This is at a time prior to COVID, and you can see the different types of mask use and adherence to certain types of mask use, despite the fact that we know that tuberculosis is an airborne pathogen. So I was there to study tuberculosis in a part of the world where TB was known to be endemic, particularly after the fall of the Soviet Union and dissolution of public healthcare systems there, leading to worsening tuberculosis, or TB, as you'll hear me describe, but also drug resistance. We all know this man, and he also recognized how important TB was to human health, and particularly to the health of his population in Russia. And so he has described in a very public way the fact that TB claims more lives than any other infectious disease. COVID has outpaced that in the last few years, and TB will soon replace COVID again as killing more people around the world than any other. But he notes that it kills people in prosperous countries with high living and medical standards. Read what you will into that statement about who he's talking about in his own country and how he wants to project the image of his country. And he describes how he's going to go on to reduce mortality from tuberculosis. It's a state priority, but in this entire discussion, he does not mention human immunodeficiency virus, or HIV. So I want to tell you a little bit about HIV and HIV in Russia in particular. So we know that tuberculosis is the leading killer of people living with HIV worldwide. And we know that HIV is an incredible driver of TB disease. You'll hear from Dr. Sinha about how important undernutrition is as a driver of TB as well. But there's one part of the world here that looks different than any other. This is an infographic from 2015. Some of these data are replicated through 2020 and beyond. But I want to point your attention to Eastern Europe, countries of the former Soviet Union, and in particular Russia, in which 80% of those new cases of HIV come from this vast and important country. But the remainder of the world virtually is beginning to see important decreases in the numbers of new infections, and that's not the case in Russia. Importantly, there are places like Irkutsk, which I've highlighted here, where our work has taken place, where seroprevalence studies among people injecting drugs have found HIV rates as high as 30 to 40%. There may be prevalence rates of upwards of even 2% or more of the general population of the country of Russia. These data are incomplete and are difficult to reliably put together. This is probably the best study of those types of reports that can be found. But I also want to highlight how important a change in mortality has occurred from 2000 here to 2018. This is a time in the world in which HIV-related mortality should be improving. And in fact, it's not. Now, some of this might be reporting and reporting on cases that otherwise weren't reported 20 years ago. But this is a dramatically different change in quote, a prosperous country, to use Putin's terms. Now, you may ask, are people thinking about this and working on this problem? And indeed, there is. That there have been a number of different collaborations here by the U.S. National Institutes of Health, or NIH, as well as direct collaboration with the Russian Foundation for Basic Research. We've been supported by a few grants through this particular collaboration. Here, the last meeting in 2019, and as I've highlighted, probably not to be replicated anytime soon, given geopolitics as they are. But there are lots of people that we're thinking about and caring about this issue, despite the fact that many scientists, even within the HIV community, and certainly many advocates within the community around the world, are less aware of what a problem HIV has become and continues to be in the Russian Federation and some countries of the former Soviet Union. To give you an example, this was a conference that I attended in Moscow in 2018, the Eastern European and Central Asian AIDS Society Conference, really where the bulk of research and policy decisions were being discussed for that region, and I would argue the most important region for the epidemic to focus on. And I compare that with a meeting I was at in Cape Town in 2015 for tuberculosis, with a big tuberculosis and HIV focus. And there was this large, quote unquote, die-in where people were demonstrating how there was a need for new tuberculosis medicines and new tuberculosis vaccine, and work with underserved populations, such as those people living with HIV that were experiencing stigma. At the conference in Moscow, I found this one person. He was the only person that was representing civil society, so to speak, in a part of the world where arguably the most important HIV epidemic is happening. And his sign reads, "Repression and discrimination are preventing, are worsening HIV prevention." So he's highlighting the repression and discrimination that's taking place. Part of that repression and discrimination happens at the legal level. And so in Russia, like many other countries in the world, the behavior of injection drug use, highlighted here in this work from the Lancet as IDU, injection drug use is illegal. People are incarcerated for this behavior. At the same time, the access to methadone or buprenorphine treatment for opioid use is unavailable and remains unavailable in Russia, and is one of the few countries around the world where that's the case. And so there have been gains made in other similar epidemics, such as in Ukraine, that's now suffered a serious setback from Russia's invasion. And there have been many more recent articles written about this problem. And I would argue it's a not so silent epidemic anymore. So what are the ways, besides antiretroviral medicines for HIV treatment and getting as many people as possible on those medicines to eliminate HIV and AIDS as a disease, but also transmitting HIV to one another? Well, those medicines have to make it into the hands of people that need them. People need to know their status to be tested for HIV. And all of the ways that we do that, that we funnel people, so to speak, into the biomedical aspects of healthcare, really require all of these upstream interventions. And so this is from the UNAIDS. And you see here, there's very little focus on, for instance, something that we might consider a pill in hand, but rather on ways to end poverty, to understand and to change policies that are both racist or marginalized certain groups of people. Now, you may disagree with certain aspects of how aggressive an approach this might be, and we can debate whether or not we should decriminalize something like drug use or otherwise. But these are strategies that have been proposed at really the highest level. But in Russia, we've noticed there is significant downstream health impacts from marginalization of certain parts of our population. And so in 2013, there were some pretty significant laws that were passed to change their approach to people of certain groups, including men who have sex with men. And this had direct effect on the behavior of people accessing care, particularly for HIV. And so coverage for certain HIV medications in St. Petersburg, one of the largest and arguably more liberal cities in the country, dropped to as low as 9%. And this is just incredible to imagine. Now, fast forward even a decade later, just this past week, Russia now seeks to ban the international LGBTQ movement as extremist. And so effectively taking any kind of public discourse around gender identity and sexuality really to a suppressive level. But of course, it is something that we here in the US are beginning and have experienced. Again, you may differ in terms of your opinions on whether or not this is reflective of our own morality and how we should proceed as a society. But I think what the experience in Russia has taught us is that there will be health consequences. And we're already experiencing that with regard to reproductive health and how even reproductive health that does not involve abortion, for instance, in the US, is being limited in certain parts of the country because there's simply no providers that are able to practice in the way that they feel fit and justifiable. But at the same time, the incarceration rate in Russia for behaviors such as injection drug use really far and exceed the global incarceration rate. And that's reflective, as you can see, really over a lot of the countries of the former Soviet Union. And then, of course, the US has the distinction of being right near the top, occasionally flip-flopping with Russia in terms of incarcerating the most of our citizens per population. This has been described as the perfect storm, a term that gets overused, but I agree with in this case in terms of perpetuating the transmission of certain infectious diseases, particularly HIV, tuberculosis, and hepatitis C. So this was a quote from one of my patients, a 28-year-old white man with injection drug use from Appalachia. It's a rural part of the US. And he said, "I like Putin style. We could use more of that here." And, you know, despite the need to bite my tongue, I did discuss with him in terms of how an approach such as the case in Russia might impact someone like him with his behaviors of injection drug use. Encourage you to read the novel by Sinclair Lewis, published prior to World War II and the rise of Hitler, and ask, you know, can it happen here? And here being the US, but pick your setting where we have the rise of autocracy and sort of the strongman rule around the world. So this was the context that we had to really work in and pivot to work in. And Irkutsk, the oblast or state with which we were working, really was the hardest hit in terms of HIV and drug-resistant tuberculosis in the context of people living with HIV, really than any part of the country. And what we found is that due to policies and to practices that really did not involve the person living with HIV, that most people that were admitted to the hospital with tuberculosis, oftentimes the first time they were diagnosed with HIV, were not being started on antiretroviral medicines. And so we know in order to treat and to improve mortality from TB and HIV, we need both TB medicines and we need antiretrovirals to treat their HIV and to improve their immune system. And so what we found is prior to working and partnering with people there in the community that really only less than 20% of people were being discharged on antiretroviral medicines. We made interventions working with people diagnosed with HIV and with the HIV center to link that center to the tuberculosis hospital in the way that they cared for patients, and found that significantly improved after those interventions. When we ultimately stopped working in Irkutsk for various reasons, but geopolitically being kind of the main reason, it was upwards of 75% of people were being discharged from antiretroviral medicine. The other aspect that was introduced, as you heard Dr. Guerrant talk about, the potential for the connectivity of a mobile phone and how that can link someone to care that they otherwise would not be able to receive in a way that was allowing that empowerment that we also heard was lacking in certain communities so affected by disease. That was the case in Irkutsk. There were many people living with HIV that were not empowered to make healthcare decisions on their own and to seek care on their own. And this is one way that we were able to do that. This was a technology that was developed here at University of Virginia by one of our colleagues, Becca Dillingham, and her group. And we were able to adapt that to the context of people with HIV and TB in Russia. What we found was that people get tired of using an app like anything else, but the use of the app for accessing HIV care and answering questions about their tuberculosis treatment, seeking services that may be unrelated to their HIV, such as housing, which they were entitled to, but weren't able to receive without being linked to a community of their peers, was actually sustained at a rate that was higher than really most commercial apps or other programs. And then in a small study, we found that, in fact, if you were discharged from the hospital using this app, you had improved mortality, which was just remarkable. So So this allowed us to start a larger project that ultimately we had to stop after COVID and Russia's invasion of Ukraine. But basically to scale up the use of this app, to scale up the use of finding people in underserved communities with HIV, and then to link these HIV and TB services together over a course of these different interventions. At the time that we had to stop, this was over about an 18-month period of time of doing it. We had screened over 4,000 people. We had expected to find and targeted to find 5% with HIV, which is a huge number. We actually found 7.5%. And then among those that were tested that were able to share that they were using injection drugs, again, well over 30% of people living with HIV that were diagnosed in those populations. So finding the people that really needed to be linked to care. Over 2,000 people were using that mobile application that I mentioned. And then this just gives you a sense of sort of the types of communities that we were able to access and were privileged to access in that context. And I think also gives you a sense of some of the differing projections of what the tuberculosis epidemic, or in this case, TB HIV epidemic, is like in Russia, differing from what, in this case, the president has projected. So just to summarize, what we've learned, what we continue to learn, HIV is a major driver of poor health in Russia. I think that's less well understood. It's a global source of the continued epidemic, and it threatens the sustainability of the gains that we've made in tuberculosis and the new drugs that we have for TB that may develop and acquire a resistance to in that setting, for instance. I hopefully have showed you that social marginalization, policies targeting marginalized groups, and certainly the incarceration of those behaviors in places like where I live in the US, but also in Russia, significantly contribute to poor health outcomes. So the Sinclair Lewis book, it can't happen here. I would argue that being social marginalization for political gain, even geopolitical gain, it can happen here. And that preventing poor health outcomes, maybe even the rise of autocracy, starts with recognizing our shared humanity. And so Dr. Grant's already mentioned this, and I highlight that again, but I am because you are. And so this is a part of the world where I grew up, and this is another part of the world that I've had the opportunity to visit many times in Lake Baikal, the world's deepest freshwater lake in Siberia. So we are more similar, of course, than we're different. So I'm grateful to the funders and, of course, to Dick's inspiration and guidance.